Good evening, Council, members of the public, friends at media. I'd like to call the October 8th, 2024 regular meeting of Council to order. First up on the agenda under 2.1 is adoption of the agenda, but with an amendment, please, to delete item 6.5, fees and charges bylaw number 901. As amended, Councillor Blanchette, Councillor Pearson. Are there any further amendments, deletions, additions? Hearing none, all in favor? It's carried. 3.1, adoption of the previous regular meeting, minutes of the previous regular meeting of Council being September 10th, 2024. Moved by Councillor McLean, second by Councillor Mullock. Are there any errors or omissions arising? All in favor? It's carried. We do have a delegation this evening under 4.1 presented by Shirley Giroux with the Planet Youth Substance Use Prevention. Welcome.
Thank you. My name is Shirley Giroux. I went to high school with the mayor. He wanted me to introduce myself with my letters, so I have a diploma in forestry, a Bachelor of Science in Biology, Bachelor of Education in Secondary Science Education, a Master's in Education for Counseling, and a PhD in Health Science, and I'm a registered clinical counselor and an approved clinical supervisor. Those are my letters. School with her. So I'm very grateful to be here tonight to be able to join you to talk about this project, the Planet Youth Project, which is something that I am the local lead or the local coordinator for, being seconded half-time for my position with the school district as the school counselor here in Valemount, to lead this project in the Valley for the next year with Northern Health. So this evening I have quite a few slides and I'm not going to read them to you, so I can make them available afterwards if you want them. I also have some papers I can leave. In general, I'm going to give you a brief overview of what this model is, why we are exploring it for use here in the Northern BC Northern Health region, and look at what we are doing in the Robson Valley specifically, and then an invitation that I will share again with Council later. So in general, this project is intended to be an upstream preventative primary prevention model for reducing substance use. So this is a classic model in public health. At the bottom of the river, you see people going over the waterfall. This is where we're working with harm reduction approaches to substance use. Kind of in the middle of the river, we can do some treatment options there to try and help people get out of the water. But the easiest way to prevent people from going down that waterfall of substance use is to prevent them from falling into the river in the first place, which is the people on the bridge, and that is through primary prevention, such as through community-based models like Planet Youth. So this model is essentially, it's a methodology or a guidance program, so it doesn't come with specific tasks. It doesn't come with specific requirements other than we follow a 10-step process that I will show you. It is meant to implement that 10-step process to help work as a community-level population, so in this case the Robson Valley, including McBride, Valemount, and the roughly 3,000 people that live along the 200 kilometers from here to somewhere between Dome Creek and Penny. It's unclear where that cutoff is. And this is to increase wellness for all young people. It is a collaborative approach. As community partners, we work together to do data collection. There is a specific survey that we use once we are in a slightly later stage of the project. We work together to see what's working, what we want to do more of, what might be relevant in our local context. So again, the Robson Valley, what 5-year period? Planet Youth is based on these 5 guiding principles. So it is the application of a primary prevention approach. So providing more recreation opportunities for young people to help give them something to do so that basically they're too tired, too busy to go out partying as much. That's the kernel of what this is intended to do. As part of that, we also work with families for right from Strong Start, daycare, right up until 15 years of age, to help families, parents better understand the importance and the value of helping their children to delay substance use. Research has shown that if we can delay substance use until after age 15, well, if young people start using before the age of 15, they are 4 times more likely to develop an addiction. So we're really looking to help strengthen families, strengthen recreation opportunities, strengthen the community so that we're able to support each other. That's that community action piece. It is led and supported by engaged, empowered community members who are making the decisions, who are figuring out what we want to do and then figuring out how to do it. It includes researchers, policymakers, practitioners, community members. So there's a lot of interest in this project. It is a Public Health Agency of Canada project, as I'll get into. It's supported by Northern Health. We're only one of 7 communities across Canada who are implementing this year. And there is a lot of interest provincially, nationally, and internationally. So we're also working with the team in Iceland who has been piloting, or not piloting anymore, using this approach for 2 decades now. So part of this local contextually mediated relevance is that we want to be able to match the scope of whatever it is we decide that we want to do to the scope of the problem. So we don't want to be doing something that's too small to make a difference or too big to be sustainable. These are the 10 core steps. Apologies for the small text. Essentially, right now we are in the first 1 to 3 steps, which is building a local coalition, so finding people who are interested in staying connected to the project work. We're going to start talking about what might be some sustainable funding sources that we might be able to access. And then we're going to start talking a little bit about what might be a reasonable way to collect data in the Robson Valley. Generally, it's with grade 10 students. Because we have such a small population, we are likely going to use birth year cohorts rather than grades. Also, grades are kind of a bit of an artificial distinction. So that's where we are right now, is with this local coalition building and starting to really think and talk about what could this look like in the Robson Valley. Once this first phase of funding runs out, so this is currently, we're in the first phase. It's an 18-month phase supported by Public Health Agency of Canada. I believe it's $150,000. Once that runs out, then we will have applied for stage 2 funding if we have been successful with stage 1, which we already had a really excellent coalition when we applied for this project, which is part of the reason we were chosen as the pilot community. So I'm optimistic that we will likely get accepted for stage 2 as well, with your support. Essentially, with this model, we're looking to reduce risk factors that contribute to substance use. We're looking to increase protective factors, so things like community connectedness, access to recreation opportunities, awareness, knowledge. So this model is intended to help. Again, I said it was a methodology, and it's a methodology intended to help us connect our young people with a greater number of healthy, responsive adults who genuinely care about their well-being, which is most adults. It is to help us really honor and celebrate youth voice even more than we already do. It is helping us to connect youth with a stronger sense of purpose through meaningful experience, a lot of which they will be helping to direct and decide. And it's to help build that sense of belonging for our young people, who then eventually become our old people. So kind of for everyone. This is just a little picture of the official announcement that was made. I think it was in September. This was in New Brunswick. That person on the far right is running the project in Cape Breton, which is one of the other 7 communities. And this just gives you a bit of an overview of what the current funding is. So Public Health Agency of Canada, across Canada, $3.1 million for this year. The other projects, as I mentioned, if you're interested, we are in this bottom cohort with the 7 other communities, being Battleford, Saskatchewan, 3 different areas in Ontario, a mixture of kind of rural, small, urban, and then Mississauga, which is quite a large urban center. We are also in BC. We have a project in Port Alberni with one of the First Nations that we intend to hopefully work with quite closely. I have a colleague in that part of the province, and we are going to be sharing information. Because part of the intention of this project is that we're going to take the work that we're doing here and apply it to the larger Northern Health region. So to have other communities learn from what we've done and learning alongside us as we're doing this. And then we're in there. There are also 5 projects that are currently in their phase 2 funding. Those are the ones at the top of the list. So they're working on really doing their data collection and starting implementation. A lot of these projects have interesting websites, and you can go and see what kinds of things they're thinking of doing. So as I mentioned, our vision for the Northern Health region is that every community in Northern BC will be a safe space for children and youth grow, learn, and thrive. So we're just piloting this work. The intention is that this is something that will ultimately be expanded to Northern Health. Why Northern Health? So Northern Health is who holds the project for Public Health Agency of Canada. And in 2023, or as of 2023, sorry, illicit drug toxicity became the leading cause of death for children and youth aged 10 to 18 in BC. And Northern BC has the highest rates of toxic drug use deaths in the province. We also have a substantial proportion of our population that are young people. Approximately 25% of our population in Northern BC is under the age of 18. We have a rather transient population, as I think we all know, with people working in sectors that, require a lot of travel. So we really want to start doing something differently in Northern Health to try and build a different kind of culture, build a different kind of community. So the objective of this first stream, as I've mentioned, is to build capacity in Northern BC, partly to address that toxic drug crisis. And we're doing that again by piloting this program here in the Robson Valley to see what can this look like? What could this work include and entail? We have a regional advisory table. I included this slide just so you could see some of the other partners. As I mentioned, there's a lot of interest in this from all of our health partners across BC, Child Health BC, Public Health BC, BC Children's Hospital, Foundries, Child and Youth Mental Health. Everyone is interested in this project for various reasons. And so we'll have a lot of attention from the health folks over the next little while here in the Valley. And then selecting a pilot community, that's us. We put in an expression of interest in May. I wrote that expression of interest with the help of some of our young people and with letters of support from 13 of our community partners here in the Valley. And it was on the basis of the strength of that application that we were selected. There's the Robson Valley. I think we all know where that is, so I don't need to talk about that. Again, we were selected based on community need and equity, so that was part of our expression of interest. Community readiness, as I mentioned, we already have had a child and youth mental health coalition here in the Valley, at least as long as I've been here, and it predates me. It used to be run by Northern Health, and now we're kind of turning that table into a Planet Youth table, and there's a new child and youth mental health focused table starting with us mental health practitioners in the community. And then feasibility. So Northern Health really believes that if anyone in the North is going to be successful, it's likely to be our community. These are some of the quotes from our local young people here in Valemount and in McBride. One that really stood out for the folks who were doing the evaluation of the expressions of interest was the one about teens really feeling like there's no space for them. So this is specifically talking to older teens. If you remember the 90s, we had the arcade. We don't have a third space anymore for our older teens in particular to just go and hang out and spend time together. You can't go and sit at Abernathy's all night for coffee anymore and hold down the booth and eat grilled cheese once every 3 hours. They don't kick you out. We really don't have the same kinds of infrastructure that we even had back when I was in high school here and when the mayor was in high school. So we have lots of young people interested in seeing this work come to fruition as well. Essentially, what we want to do in this first phase as a coalition is to work together to understand what opportunities we might have. So what are some things that kept you out of trouble as a young person, really inviting people to think about what are some possibilities that maybe we can revisit or look for that already exist here in some way, shape, or form and go from there. We want to identify and address gaps in service that currently exist. We've noticed at our VAX meeting the other night, we noticed that there's kind of a lack of coordination and communication between different activities happening in the Valley. So this is going to also probably include even just some of those communication and coordination pieces so that if there is a registration happening for one activity, like Rangers registration just happened last week, maybe we can also use that as an opportunity to connect with people in other ways and get more people involved both in Rangers and in whatever other opportunities might be available at this time. We want to make sure that we're working and building with sustainability in mind, and we really want to engage and support our caregivers in the community, so parents, guardians, daycare providers, really recognizing that this is work that spans the lifespan, focusing on young people, but all young people ideally are going to grow up to be old people, and then we want them to still participate in their community. So as I mentioned, this is likely going to include some kind of coordination and collaboration work, really being deliberate in maintaining multiple means of communication and feedback, Currently, as I invite people to join the coalition, and everyone's invited to join the coalition, the bar for participation is that you're willing to receive emails just to keep tabs on what's happening with the project. If you see something that you want to weigh in on, or that an invitation to an event that you want to come and take part in, you are welcome to do that, but not obligated. So really trying to honor people's time and existing commitments, while also recognizing that the more perspectives we can have in our coalition, the stronger this work is going to be, and the more representative it will be of the actual needs and capacities in the community. And that, of course, is also going to include the looking for funding sources. In terms of our local youth, we have funding set aside to make sure that youth are compensated for their time, so they're not, you know, we will be relying, and I already do rely quite heavily on them for their opinions, for their stories, for their ideas. And so, you know, I get compensated for my time to be at work, whether with this project or as school counselor, so we're also making sure that they are being compensated for their work on the project. In general, this is going to be an iterative process, so we want to learn about the community, and then use that learning to grow the community, and then celebrate that growth, and then channel that into more learning, and just to keep going in this beautiful iterative cycle. The coalition is very important to support this work throughout its the span. The local coalition, we are who hold the local knowledge about the community. There was a reason they wanted the coordinator to be from the community, because connections already exist. You know, we're kind of already hitting the ground running. The better we can work as a coalition, the more effectively we'll be able to potentially see something actually happen. Keeping that in mind, community work is long-term work and it requires patience, but I am optimistic that this will be work that you'll be hearing about for a while yet in the Valemount area, and I will be submitting another request to council for a future meeting. So thank you for letting me speak tonight. I appreciate your time.
Thanks very much, Ms. Giroux. Motion to receive the delegation. Moved by Councillor Mullock, second by Councillor McLean. If you could, are you available for any questions, comments? Cool. Anybody want to start us off?
Oh.
Well, I shall say thank you very much. Maybe I can get some discussion going. Thank you for championing this. I'm really pleased that Valemount was chosen as a pilot along with 7 communities across Canada. If you're looking for people who care, this is a nice little plug for me. If you're looking for youth to be tired at the end of the day, we do have a Firewood for Seniors on November the 3rd. We can use some volunteers with people who care and give them a voice and purpose. How will you maintain confidentiality?
Confidentiality in what respect?
So as you learn, as you grow, youth will give you information in terms of personal medical needs and other impacts that they're facing. Will confidentiality in that space be maintained?
I don't anticipate getting much in the way of medical needs or medical impacts. As a counselor, as a mental health professional, maintaining confidentiality is kind of my default at this point. So in general, as we're doing the work of, say, like I really want to, there is a research component to this, so there's also some confidentiality potentially in that, which is where my mind actually goes. I intend that before we start doing any large scale or even small scale research that, you know, there will be a informed consent procedure made clear to anyone who's participating. I am optimistic and hoping to be able to collect stories from people about things like what was something that kept you out of trouble. So just being very clear that your story is your story. However, if you're sharing it is with the intention that we want to share it as a community and look and see what kinds of commonalities are we seeing? What kinds of themes are we seeing in terms of what has worked for people in the past? You know, what can we learn about what we might apply in the future? In terms of medical information, I think that would probably be coming to be more as a counselor, so it would probably just stay under my counseling hat as a matter of course. But yeah, from the research perspective, definitely informed consent procedures to make sure that if people are sharing a story, you know, that they can get it back if they want. They recognize that it'll be anonymized so that you don't have identifying details about, you know, specific people. Unless a person's story is something that everyone in town remembers, I can't control for that. But, you know, just for people to be aware of the risks of the potential that they might be recognized through that. Trying to be as transparent as possible.
And then, as you know, the province right now is in a period of interregnum, so no ministry is doing any sort of work, but following the election and the formation of the cabinet, this council, I'm sure, would be pleased to be working with, you know, say, whatever ministry is formed, but in terms of the last government, you know, mental health and addiction, social development and poverty reduction, particularly the parliamentary secretary for youth, et cetera. So we're looking forward to seeing how we can contribute in principle with the coalition as well. So thank you very much again for your presentation.
Thank you.
Councilperson.
Yeah, thank you. So quick question, when you talk about the data collection, focusing on the grade 10, so 15, 16-year-old, just what kind of data are we looking at? Are we looking at what they perceive as needs and requirements in the community, or is there a little more hard fact?
So that data, the data that is collected by the team in Iceland, so Iceland still runs the research, like the quantitative research portion of this project. Here in Canada, we have a bit more of an interest in qualitative research. I know I personally, for my doctoral thesis, I used mixed methods, story work plus quantitative surveys, and I like being able to combine the data sources to get a bigger picture, a richer representation of what might actually be happening and how we might find some leverage points to make change. The data on the survey is very similar to a BC-made instrument called the Youth Development Instrument, which is out of the Chart Lab at Simon Fraser University. It asks young people about when they or if they have used various substances, drinking. I can't remember how they divide out different kinds of drugs, smoking, vaping. They ask them about their experiences, like in their families, in their community. So it's meant to get a picture of where are they right now. So for example, in Iceland, when they first started collecting data, they had proportions in the vicinity of it. It was somewhere just under 40% of their youth had reported drinking in the last 30 days. And then over the term of the project, and I didn't bring those numbers. I didn't realize you're a numbers crowd. They did manage to reduce that to like under 10%, like well under 10% through the intervention. And again, there, the interventions were things like access to a recreation pass, free of charge for everyone. They had parent patrols going out and doing, kind of like, remember COPs? Do you remember COPs? Yeah, kind of like that. But also in Iceland, they have 24-hour daylight. So they were having like herds of teenagers strolling the streets at 3 a.m. in bright daylight. So it really does need to be locally and contextually relevant and mediated, but the data is kind of their experiences and their substance use, reported substance use.
Thanks.
Yeah.
Hearing nothing further, and please accept my apologies for misspeaking your title before, Dr. Giroux. Thank you once again. We are full of gratitude for your presentation this evening. Thank you.
Thank you. I go by Ms. It's all good.
Any further comments, discussion on the delegation? All in favor of receipt?
I like how that she assumes that we get into trouble in our youth. Sam?
And you're still contributing to community? Nice.
I don't think so.
And that's the stories that you're gonna get.
Remember, we come from a pre-cell phone era. There's no records.
I'm grateful for that.
All in favor of receipt? Thank you. We do. 5.1, the NDIT Business Facade Improvement Program, looking to approve staff to apply to NDIT in the amount of $10,000 for the Village of Valemount's continued participation in the business facade improvement program. Moved by Councillor Blanchette, seconded by Councillor McLean. Discussion?
This is a really good program. The Chamber of Commerce did it for a long time, and it just benefits the community. So thank you to NDIT for returning to do it again.
Awesome. Councillor McLean?
Does this still just apply to the main corridor, or does it wrap around up in Railtown now too?
Ooh. I would look to administration for that.
I believe it's the main corridor, if I recall correctly. In the program, you need an area defined by some particular attributes, and so a downtown core is an easy definition to use.
Further discussion, questions? All in favor? Carried. 5.2, Village Airport Fuel Tank RFP selection. Looking to approve staff to enter an agreement with Code Project Enterprises Limited for the installation of a new airport fuel tank replacement in the amount of $174,522 plus GST. Moved by Councillor Pearson, seconded by Councillor McLean. Discussion? As you can see in the report, Mr. Balcony has done the bulk of work to our already existing fuel distribution system. All in favor? It's carried. 5.3, the Resort Municipality Initiatives Funding Report is there for your information. Is there any anything within that that folks would like to bring out? I understand administration is benchmarking with other resort municipalities within the Communities Collaborative, and it's all over the place in terms of municipal needs, municipal wants, not-for-profit, recreation development, whether it's 10, 90, 60, it's all over the place. So we'll be continuing to do other benchmarking. 5.4, Municipal Corporations Board recruitment. We're looking to approve an out-of-cycle recruitment for the boards of the Valemount Community Forest Corporation and the Valemount Industrial Park Corporation. Moved by Councillor Mullock, seconded by Councillor Blanchette. Discussion. Thank you to those that did apply to those corporations. Be getting on to their second meeting, third meeting.
Second meeting will be coming up next week.
Yeah. All in favor? Carried. Excuse me. Bylaws and policies, 6.1, officer designation, delegation of authority, amendment bylaw, number 897, 2024, looking for final adoption. Moved by Councillor Pearson, second by Councillor Mullock. Discussion on final adoption. All in favor? It's carried. 6.2, permissive tax exemption bylaw, number 898, 2024, looking for third reading this evening. Moved by Councillor Blanchette, second by Councillor Pearson. Discussion on third. Councillor Pearson.
I know there's been some discussion on item 6 of this with the technology allowance.
You're referring to permissive tax exemptions or the next item, Councillor remuneration?
Oh, sorry, did I jump ahead?
Only if you want to.
Nope,
Any discussion on 6.2?
you were there.
All in favor? It's carried. 6.3, council remuneration bylaw number 899, 2024. We're looking for third reading. Anybody want to put that on the floor? Councillor Pearson, seconded by Councillor Blanchette. Councillor Pearson.
My apologies, I kind of jumping ahead on my agenda here. So yeah, looking at the remuneration bylaw in some of the conversations that were going this week, regarding the technology allowance, item 6, number 5.1.2, if required, TELUS internet service for the use of the iPad. I'm kind of looking for clarification. Seems to me, to my recollection, this was sort of aimed at when we got the iPads, they didn't have a SIM card for access without Wi-Fi. And so my recollection is that that's what this was referring to versus an external internet service. If I could look to staff for some clarification.
Madam Administrator?
Yeah.
You want me to push that button?
That would be a great idea right now. I'm looking at our finance director for some more clear information, but I believe so. I believe there were, when the iPads were first issued, that in order to access agendas, there was that potential. I believe there was only ever one that had a data card installed. Am I correct? I'm speaking to a time when I wasn't here, so.
Yeah.
I believe that that was the intention.
Okay. Yeah, that's just the clarification I was looking for on that item, so.
Further discussion? Then all in favor? Carried. Got all my C24. Looking for adoption. Councillor McLean, second by Councillor, who has a dog? Councillor Pearson, seconds. Discussion on final. Reading file. Is there anything folks would like to bring to surface?
We missed down 6.5.
6 point, no, we removed that.
What would that?
I'd like to bring out the correspondence from MLA Shirley Bond and provide our immense gratitude for her years of service to not just this council, but to the residents of Valemount, the Robson Valley, and the riding of Prince George Valemount. And if with council's grace, I would like to write said letter. Write said letter. Moved by Councillor Blanchette, second by Councillor Pearson, that this council send a letter of gratitude to our outgoing MLA, Shirley Bond. Discussion? All in favor? Carried. Thank you. Councillor Pearson.
Yeah, just referring to item 13, letter from the Mayor of Merritt. Must be a tongue twister in their meeting. Regarding the delinquent taxes, I'm just curious, I guess question to staff is if this is something that we've seen here where people's taxes go delinquent for 3 years and then they pay 1 year, that buys them another year. I'm just wondering if that's...
Not sure how common it is, but I'll refer to Madam Administrator, who will probably refer to our Director of Finance.
Almost certainly, I will refer that to the Director of Finance.
Please.
Yeah, I'm just curious.
I believe usually a number of, I'm going to say an average of 25 properties every year. So it's not a huge deal.
But is it a recurring theme like this where they go, really?
I think we have a low
Yeah,
for larger cities.
interesting. Okay, thank you.
Was there anything else, Councillor? Councillor Millick?
Yeah, just to add to that, yeah, because in that letter, the numbers that they're talking about is astounding. So I'm happy to hear that that we're not in that realm.
We have no correspondence for action. We do not have, does anybody have a notice of motion to bring forward? Then we, council reports under 12.1. Who wants to go first?
I'll go first.
The one that
Mine
didn't
is
go to
short.
UBCM.
Yes. The only one I had was September 24th, and it was the Community Collaborative. And we renamed ourselves, and I cannot remember what our name is. I forgot my notes. Remember? Or am I in the, no, that's right.
No, yeah, we
Yeah.
changed the order of the wording.
Yes. So we do have a new name. Apologies, I left my notes at home. But we have changed our name, same goals exist, and that was it.
You. Short and sweet. We'll head down the table. Malik.
Okay, September 16th, UBCM, meeting with the Seniors Advocate, Dan Levitt. Shortly thereafter, we had another meeting with PAX and the Jedi Ministry staff. Both very interesting meetings. September 17th, attended Innovative Solutions for Rural Healthcare Access. Hope Air, Helicopters Without Borders, and others were represented. Very interesting. The numbers that, back to numbers again, that was quite astounding to see what some of the costs were that people are having to endure. Also, next on the HIP parade was the Small Talk Forum, panel discussion of issues affecting smaller communities. And after that was the meeting with Minister Nathan Cullen, the focus on the Weir for Kinbasket Lake and development strategies to achieve, and looking for the advocacy. After that was a workshop building fire smart communities utilizing post-fire learning, and that was quite interesting, some of the examples that were used. And that quite, hopefully everybody was listening and can take some of those ideas home with them. On the 18th, the opening session commenced, resolutions addressed by the Minister of Municipal Affairs, Minister Kang. After that was a cabinet town hall with emergency preparedness being the topic, with Ministers Ralston, Ma, and Cullen attending. That was also very interesting after having the the previous one. On September 19th, started off with resolutions once again, and the address by the Premier David Eby. Shortly or partway through that, we had a meeting with the President and CEO of Northern Health, discussion of the potential master plan, challenges and potential solutions, workshop, Friends into Electrifying Transportation, which was quite interesting because a few days later I was involved in a little bit of discussion on that. On September 20th, resolutions addressed by John Rostad and Sonia Firstino. Very interesting listening. September 24th, I had attended the Valemount Entertainment Society AGM. September 25th, Village Open House at the Community Hall, and attended that with Councillor Pearson. On the September 27th, we had the Electric Vehicle Association event at the high school, and I got to attend with the Village F-150 Lightning. First time I've ever driven a electric vehicle, and I loved it, I have to say. And that was actually a really interesting thing, because all the high school kids were there, and a lot of really good interest in things. And what I found really good about this was that so there was about a dozen different vehicles represented and owners. They were talking pros and cons. You know, they weren't trying just to sell you on electric. They're saying no. You know, there's applications for certain things. You know, certain cars you're going to want to use for this, and certain things you're going to not want, or something you're going to have to consider living in a northern community. So yeah, just a great learning situation. I really enjoyed that part, and that's it for me.
To to your UBCM, the after-action reviews for community emergencies must have been just fascinating.
Absolutely. Absolutely.
Oh, we're McLean.
Okay, so back to September 12th was the Valemount Community Forest regular meeting. And on the 16th, of course, UBCM, along with Mayor, Council, and the CAO. Activities on the 16th were a meeting with the Seniors Advocate regarding options for healthcare, mobile healthcare services, and home care for seniors. And then a meeting with staff from Jobs and Economic Development and Innovation and the Ministry of Tourism, Arts, and Culture regarding the recent economic impact survey, potential government supports for affected businesses, and marketing support. And the studies session, Communities in Transition. On the 17th, activities included the Small Talk Forum, a meeting with Minister Nathan Cullen, Minister of Water, Land and Resource Stewardship, where we asked once again for a weir on Kinbasket Reservoir to help prevent dust storms and provide better recreational opportunities. Later, we attended a session on fire smarting communities, lessons learned from devastating wildfires around the province. On the 18th, activities included resolutions and the trade show. And on the 19th, trade show again, more resolutions, the Premier's address, a meeting with Northern Health Authority to discuss the regional hospital master plan, and a workshop entitled Mental Health and Elected Leaders. Later in the evening, we attended the UBCM banquet. And on the morning of the 20th was another morning of resolutions. Yesterday was the regular meeting of the Columbia River Treaty Local Governments Committee to continue to look at the agreement in principle and determine the next step.
Are we any closer to modeling?
No,
So we have no idea what the 3.6 is going to do
not yet.
for water elevation. Okay, fair. Councillor Pearson?
All right, September 12th, the first meeting of the Valemount Industrial Park as its own board. Yeah, I'm looking forward to see how this moves forward in the future. A lot of the UBCM is very much the same, so I'll just hit a couple of high points. Community in Transition session was very interesting. There was a lot of talk, especially in the lumber industry, on how carbon tax and 24 current government policies are driving investment away. And they talked a lot about the value added factors in that everybody looks at value added as being that finished product, where they show the biggest value add is from stump to mill, and then from mill to factory before it becomes the finished product. That's probably the lowest value add is the finished product. It was quite an interesting discussion. And then some discussion on the benefits of the community forests in the communities. Some great numbers in the morning session on innovative solutions in rural healthcare. The work that Helicopters Without Borders does mostly in northern Indigenous communities in BC, where they fly in mobile clinics complete versus people having to leave the community to get healthcare. And the numbers for Hope Air were astounding, and how many flights they are doing. They showed last year total flights in Canada were 24,000, and BC has almost matched that this year. So a lot more visibility and promotion for them. And it's not just a lot of people when it says Hope Air, but they deal with transportation, accommodation, to medical care. They get you from the airport to the hospital. It's a full meal deal, so it's well worth looking at for anybody that has financial challenges to get to healthcare. Excuse me. Our meeting with Minister Cullen for Water, Land, Resource Stewardship, and kudos to Councillor Mulek for taking the lead as deputy mayor for the first couple of days. And the discussion on the weir for Kinbasket, you know, we really hit with the health effects of the dust. And, you know, that's kind of our focus issue, but we also brought in the economic benefits that would be from having permanent water at this end of the reservoir. And as we were leaving the meeting, his discussion was that should be our leading point, his ECDEV towards potential versus healthcare. And it caught me off guard because, I mean, I'm more worried about keeping our people alive than, you know, awesome. Some of the things that was learned, the fire chief, and I can't remember his name, from Kelowna, was one of the lead speakers. Very, very powerful. The rest was pretty much already talked about. The mental health and a local elected leaders workshop was very impactful. And they are going to continue a program for those that were interested as a, I don't know if you call it a working group, but people that are interested will be on a, right now it's over 60-person Zoom call talking about mental health. September 24th, Community Collaborative along with Councillor Blanchette. And September 25th, the Village Open House with Councillor Mulek, where we got to answer a few questions. And quite surprising, none of them were about the entrance sign. That's my report.
Thank you. September 11th, I had a meeting with the Regional District and the Ministry of Agriculture and Food around the veterinarian shortage. Same day, we had several committee meetings, starting with agriculture, then environment and parks, and finally public safety and emergency management. I was elected chair for that committee. September 12th, we had the regional hospital board, and then the regional district, Fraser Fort George, closed and open board meetings. September 13th, I was caught off guard, had a discussion with Yellowhead West MLA Martin Long, who represents Jasper. We had a very good discussion around the evacuation and ensuing economic impacts. And then later that day, had a planning meeting with the Resort Communities Collaborative, RCC, Advocacy Working Group, AWG. I say that because it comes up again later in my report. Before I get to the Union of BC Municipalities, I do want to thank Councillor Mulek, Pearson, and McLean for really representing Valemount well. I heard nothing but good. Apparently nobody made a poor decision while you're down in Vancouver on the first couple of days. There were no late nights and always early mornings. And to our administrator for staffing supports while down there, herding cats in some instances. And then finally to Councillor Ron Lampro Jr., First Nation, for joining you all for the meetings on Monday and Tuesday. The 18th, I barely made it to the North Central Local Governments Association luncheon. And then with Councillor Mulek, right after that, had a meeting with the Honourable Minister Lana Popham and the RCC AWG regarding what an RMI, Resort Municipalities Initiative, funding source looks like moving forward. Then with Councillor Mulek, attended the Cabinet Town Hall on Emergency Preparedness with Ministers Cullen, Ma, and Ralston, to which Minister Cullen gave a kind shout out to the village for our response to the Jasper wildfire evacuation. And then in kind, I responded with gratitude to our staff team here at the village for really putting out that extra energy for our friends, neighbors, and absolutely complete strangers from Jasper National Park and the municipality. The 19th, I thought it was a great meeting with the Northern Health Authority CEO, Chiro Panessa. The master plan, I think we can hit on all boards there. So how, moving forward on that master plan. The morning of the 20th, with our administrator, we had the Resort Community Collaborative Breakfast with it was all the mayors this time. And most of the CAO has announced his retirement. They are currently seeking a replacement for his, along with Mayor Al Rain, the RMI process in the Resort Community. Northwest Power and Conservation Council, their vice chair, their executive director, they have general counsel on staff, as well as their staff team from public affairs. Also have the Columbia Basin Trust annual general meeting, as well as the Columbia Basin Trust board. And then yesterday, I had some time with Mr. Peters at VCTV and an interview around our new entry sign. Some great questions from our media partners, and again, gratitude to the council for UBCM. Oh, I did forget one. We had an overview by Kathy Eichenberger herself in person around the Columbia River Treaty Agreement in principle. A lot of work has gone into that, and she's staying on until this gets ratified. So kudos to Ms. Eichenberger and her team. That's my report. Motion to receive. We don't receive these anymore. We should. Got to get out of that. Any discussion on the reports? Calendar of events is there for your information. You will notice we actually have scheduled dates ahead of time for Valemount Industrial Park Company and Valemount Community Forest meetings, so they're there for your information. Anything else, folks, want to get out of the calendars? Okay. We do have time now for public comments under item 14.1 on items discussed as part of the approved agenda this evening. Are there any public comments this evening? Jasleen, nothing? Okay. No comments. Okay. We are not going in camera this evening, so I'll ask for adjournment. Councillor Pearson, thank you.
Thanks for mentioning Ron, too. I forgot to include that.